Okay, today we're going to do assessing the uterine fundus, fundal massage, and Lochia determination. Fundus is the top of the uterine round portion of the uterus found at the top. It is found higher on the uterus than the entrance of the fallopian tubes on the uterus. It is formally known as the fundus uteri or known as roof cavity. So, involution of the uterus, the process of reduction of the uterus to its normal non-pregnant size and states following childbirth. For the lochia, is the vaginal discharge that occurs after delivery during the postpartum period. And basically, the uterine wall shading its lining after birth. The uterus is healing and returning to original pre-pregnancy size. The objective is to determine the location of the firmness of uterus, assess and identify the deviation from the norm, assess and support the woman's normal recovery by immediate intervention. The equipment that we need is the gloves, perineal pad, linen saver pad. Next is the procedure. First, explain the procedure, wash your hand, and provide privacy. Explanation relieves anxiety and facilitates cooperation. Washing hands prevents contamination. Privacy prevents embarrassment and lessens anxiety of the patient. So, ask the patient to empty the bladder if she has not voided recently. So, good morning, ma'am. Pagdalisigan melat yo ang diri sa Fundus and Lochia. So, ma'am, katong ni ma'am if nakapangi ka na.
Promise niya.
And then have the patient assume supine position with knees slightly flexed or dorsal recumbent position. This position relaxes the abdominal muscles. So, mama, pwede lang ka slightly flex ang imong or dorsal. Then put on protective gloves, lower perineal pad. Observe Lochia as fundus is palpated. The gloves is protected the nurse from any spread of microorganism and contamination from any secretion. And careful observation can clearly determine any possible hemorrhage earlier. So, ma'am, start na ka massage, ma'am. So, first is place one hand on the lower uterine segment using other hand and palpate the abdomen until the top of the fundus is located. To determine the firmness or uterine firmness or uterine atoning or bogginess. And one hand palpate while the other hand support the base on the uterus. If it's baggy or the uterus is not firm, then massage lightly in a circular motion. Massaging the baggy uterus in a circular motion will promote firmness and muscle contraction that could help expel excess uterine fragments that's still remaining. Then, perform uterine massage every 10 to 15 minutes for the first hour after birth. To reduce the risk of postpartum hemorrhage and assist the uterus shrinking back to its pre-pregnancy size. And every 30 minutes during the second hour, after the first 2 hours, this massage will usually happens every 4 to 8 hours until discharge. Next is determine the height of fundus. Measure the height of the top fundus in 2 finger breadths above, below, or at umbilicus. To detect the shrinking back of uterus to normal size during pre-pregnancy states. So, the fundus is in the midline, and deviation from the proper location indicates the full bladder. Then, document the consistency and location of the fundus. It helps to monitor the condition of the normal uterine involution. The consistency is recorded as the fundus firm with massage or fundus baggy. The proper documentation promotes proper intervention that could be done immediately if there is a problem noticed on the chart. Then, make the patients comfortable. Conducive environment enhance healing the process as the patient experience comfort. So, Miss, makabalik ang sa position, Miss. So, thank you. Gid sa pag-coopera mo, Miss. And that's all for the assessing the uterine fundus, fundal massage, and Lochia determination. Thank you.